Breaking news just coming in 5:51. Oxygen generation plants are going to be set up in public health facilities across the country. Oxygen generation plants are going to be set in government hospitals and district headquarters across the country. The PM has directed that these plants should be made functional as soon as possible. The PM Cares Fund had earlier this year allocated 201.58 crore rupees for installation of additional 162 dedicated pressure swing absorption medical oxygen generation plants inside public health facilities in the country. Paulami Saha breaks the story first on India Today. She's joining us for the very latest. Paulami, we're talking about the oxygen supply here. The Prime Minister now directs that these plants should be made functional as soon as possible. Question is, why did we wait for so long?
Well, obviously, those are the questions that are being raised because this is not the first time that the central government has, in fact, floated tenders for the setting up of PSA oxygen plants in, hospital facilities, in hospital premises. Earlier, a tender in October for 150 such pressure swing absorption plants were, in fact, oxygen manufacturing plants were, in fact, floated. And then, of course, in January this year, as you told our viewers, the allocation was increased. 162 PSA oxygen manufacturing plants were to be set up. The allocation was about 201 crores from the PM Cares Fund. But on the 18th of April today, the Ministry of Health and Family Welfare, on the 18th of April, in fact, informed that only 33 of these plants which were to be set up were in fact functional. Now MHFW, the Ministry of Health and Family Welfare, is in fact the nodal ministry for the setting up of these plants. So the question still remains as to why did we in fact wait all of this while. Now the Prime Minister of course has given that more funds, has given orders that more funds from the PM Cares has to be allocated for the setting up of 551 such PSA oxygen manufacturing plants inside hospital premises at the district level, and they should be made functional as soon as possible. It remains to be seen, of course, how soon is that going to be possible, given that we are facing a crisis situation in the national capital, and there are other states as well which could possibly, if the numbers were to spike, given that doctors are predicting that there could be a spike in numbers, could possibly face a shortage of oxygen.
Absolutely.
As well.
Absolutely. And Paulami, that big question still arises as to why is this being done now and why was this not done earlier? Why did we even come to